Hi everybody, and welcome to the Healing Point Massage Therapy YouTube channel. My name is Alana, and joined as always by Liana Bergonia. She's the owner of Healing Point Massage Therapy located in St. Albert. It's a special episode today, isn't it?
Yes, I love to talk about my manual osteopathic therapy techniques.
Excellent, I can't wait to learn.
Yes, I love to read this quote from Andrew Carnegie. There is no use trying to help people who do not help themselves. You cannot push anyone up a ladder unless he is willing to climb himself. Yeah,
I love that
You have to
quote.
help yourself, right? Yeah.
And that's what massage is, helping yourself
Yeah.
be the most
Better.
healthy version of you.
Yes.
Excellent. I found a statistic that said there are approximately 5,000 manual osteopaths in Canada, and half of them are in Quebec.
Not a lot. Would you say?
Not a lot.
Not a lot. Not very known yet, but we're gonna get there. We're getting more, and I'm just excited to this treatment will be known in the future. Yeah. So after getting massage therapy for over a year, I realized that massage may not be the best, the most beneficial treatment, because it was only treating the symptoms, right? And not the main cause of the issue of and then after scanning the body of a client, usually we're able to fix their issues with manual osteopathic treatments. That's not actually was helping with the massage that I was doing with them before.
Wow.
Yeah.
So manual osteopathic therapy is so beneficial to prevent the problems that keep people coming back.
Yes, and then just finding what's causing this. Yeah.
Excellent. So how does the manual osteopathic therapy start?
Yeah, so usually we book for 60 to 75 minutes of massages. So we start basically with history. So I ask for past accidents, surgeries, or injury, even small injury like falling off the tree. It's so important to know those little things, and then of course medication because medication may affect the outcome of the treatment. So it's nice to know all those. And then now that once I get that idea from the client's body, what it went through, all the accident past, everything in the past, and then we compare to the current assessments to what they present now, and from the physical observation to the client. So we start with some standing. There's a seated assessment. There's a lying down assessment. We check when they're standing. We check for symmetry with the body. Is there a leg shorter? It's how is the body presenting, right? So is the client's leaning onto one side? Is it like the general posture? We look at all those, and then we check for the function. We call it functional assessment. That's what we check next. We check for we ask the client to move. So we'll check how is your range of motion of your neck, your shoulder, your hip, either to do a forward flexion or a side-to-side bending. So the little things that to know what they can do. And then of course we assess for mechanical function of client and see what they can and what they can't do. And then there's some specific assessment when we check the alignment of the spine, if there's any rotation, if there is anything that's kind of out on the spine of the client, we check that as well. And then we also check for organs. We check for the passively without moving the organ. We just listen to it. We call it motility. And then there's also active checking of it. Like we check and move a little bit the organ to check and see if it's moving on its own axis that's supposed to move. And then also we check for as active and then passive, meaning we move it for them. We check all of that through all the different joints, the muscle, all the other tissues of the body, the tendon, the ligaments. We wanted to know and understand what is not moving very well. So those are little things. And then so much to check for. It's kind of really, really interesting. And then we check for clients laying down on the table. We check for, we call it the T line, like the fascia line to our body, like from head to toe. Like we check for little, subtle movements when we feel the restriction of the body. And then we also check for, we call this kind of vitality, or through light touch on the cranial bones. We check each movement of the, because there's a lot, it's not just a one bone, there's a few bones there that moves, they had this movement on them, and we check those because we assess the movement of the fluid, the craniosacral fluid is what it's called, in the head, in the sacrum, in the shoulder, and the hip, and to the legs, and even on the top of the feet. So there's all this fluid to the body. They should be nice and flowing to our body. Yeah, so we call that craniosacral fluid. And then we check the history. We check what they can do. We check the actual restriction onto their body. We take all of that, and then we add together, and then we develop a treatment plan for them, for the clients. So then we use this different manual therapy, which I will discuss later. These are all light, non-invasive techniques to try to take out the restriction. Because we treat the cause and not the symptoms, and just try to balance the body, take out the restriction, get that all moving, and so that their body can start to heal their own. Because that's what our body is supposed to do, is to just heal ourselves. We just kind of facilitate, right? We just treat the client, but we just facilitate the treatment, but the client's body is actually do the rest of the healing.
Wow, that sounds like a very involved process.
Yes, yeah, and it's just very interesting for each client that come in and oh, that's even connected. So, yeah.
That's amazing. I wonder what my body says.
I would love to see you for that treatment.
And so what is muscle energy technique? You alluded to that earlier.
Yes, yeah. So the first one that I would like to discuss is the muscle energy technique, or MET. I have a little note here from Massage Therapy Principles and Practices by Susan Salvo. She talked about the reciprocal inhibition. So I quote: when the central nervous system sends a message to the muscle causing the movement to contract, the tension in the antagonist, or the muscle that opposing the movement, is inhibited by impulses from motor neurons, and thus must simultaneously relax, unquote. So this means that our muscle act in pairs. So then we have a bicep and a tricep. When the bicep contract, the tricep relax. So that's basically the idea of it. And they simultaneously always kind of contrast, so that we don't have injury. So that's kind of the basic of our body movement. Excellent. So MET is actually based on the principle of reciprocal inhibition. So that one that I just mentioned. The trick is we use reciprocal inhibition to further relax a certain muscle and help balance out the area that we're working on. So we're not just gonna work on the tricep tightness, but it's a different kind of treatment where we use what our body do to help release the tension on the muscle. MET is use of clients' own muscle energy to realign joints and realign joint surfaces and correct the muscle imbalance in a safe and pain-free manner. It involves voluntary contraction of client's muscle, usually about 10% effort. We ask them about push in this direction for about 10% effort, and precise, and it's a very controlled intensity against counter force, kind of applied counter force by the therapist. And then of course this is designed to lengthen the muscle and the fascia, increase tone in the weakened muscles, and just mobilizing the joints. Yeah.
Wow.
It's a very kind of longer, but yeah, it's a little different type of correction, because you correct if there's something that's misaligned to your spine or any irritation through the spine there. We use this technique to correct that without any high velocity thrust.
Wow.
is a lot more, more safe because the client is the one pushing it, we're not the one pushing. Yeah, so it's different.
Wow, that's a very involved process.
Yeah.
It sounds like it would be very beneficial.
Yes.
Excellent.